Matters program. It's your girl, Labake, also known as Elizabeth, the anchor of your Health Matters program. Today we are on the 47th edition of your Health Matters program. And the topic today is metabolic syndrome. Before we go into details, I would like to welcome my guest on today's program. So he's a general practitioner. He's going to introduce himself. So thank you so much, Dr. Morris. Can you please introduce yourself to my audience?
Thank you, Elizabeth. Hi, I'm Dr. Morris, Sebastian Morris. And I've known Elizabeth from working in psychiatry a while ago. It's a bit about myself. I did a first degree in neuroscience in Leeds, and then I did medicine at the University of Birmingham. And for the past, say, 7 years, been working in the NHS, different hospitals in Birmingham and London. Worked through lots of different specialties: medicine, cardiology, surgery, psychiatry, gastroenterology, and so on. And the last 3-4 years, I've been working as a GP.
Thank you so much, Dr. Morris. So the topic, like I said, is metabolic syndrome. So when we say metabolic syndrome, what is metabolic syndrome? In a layman language, for people who are not in the medical line, what do we mean?
Yeah, that's a good question. And it's a big problem. A lot of people don't realize that they have it. And it's a combination of 5 things. And if you have 3 of these things, then you can be diagnosed as having metabolic syndrome. But it sounds serious, like when you name something syndrome. But what it all means is that it's a collection of, you can say, 5 risk factors, something that you may have that increases your risk of other problems. So just to kind of, like you mentioned in layman terms, the way to kind of think about it is like maybe if you imagine your body as a factory, you are the owner of a factory, okay? Suddenly over time, you notice that business is just not as good as it used to be. You're making less product, you're thinking of like you're feeling tired, you're making less money, your employees are unhappy, like different parts of your body just not working very well. And then you start asking like, what's going on? And everyone's saying, I've got one problem. I've got high blood pressure, and then I've got diabetes, and I've got this. And then you realize there's an imbalance in your body. And what happens then, your business starts going downhill. You may go into administration, you go bankrupt. And that's when all the complications start happening in your body. So that's it. Metabolic syndrome is this combination of problems that increases your risk of type 2 diabetes, getting heart attacks, stroke, kidney disease, and liver disease. In the next maybe 10, 20 years, it's going to be even more potentially dangerous than smoking. I'm not saying smoking is less dangerous, but this is going to take over how much impact it's going to have on people's health.
Wow, thank you so much. That was actually well defined in a way that everyone who is actually not in the medical line will understand. So what are the signs and symptoms of metabolic syndrome?
So these signs and symptoms, they're kind of like a hidden problem, so to speak. So a lot of it is picked up when you go to a doctor to get checked out. But these are things that some of these things that you can realize yourself, okay? So these 5 things that I mentioned, one is having high blood pressure. They say over 130 over 85. We'll go into a bit more detail in a bit about like how you figure out if you have high blood pressure and things. I'm going to put it the second one, it's high blood sugar. Not necessarily having diabetes, but your body not being able to deal with sugar very well. Third thing is what they call triglycerides. This is a type of fat that's in your blood. Often pick it up whenever we test your cholesterol. And then 4 is having low levels of a good cholesterol, which we call high density lipoproteins. And then 5th, which almost everyone can identify themselves, is abdominal fat. And by that, we mean generally having a waist size of more than 35 inches in women and more than 40 inches in men. Just on that though, I'm not saying that everyone who has that waist size has metabolic syndrome. You have to have at least 3 of these 5 things that I've mentioned to be considered as having metabolic syndrome.
So out of that 5 things, because you just said until people are tested, they don't know.
Mm-hmm.
So as we know, reality, people barely go to their GP.
Yeah.
So
yeah.
go on.
Yeah, you're right. How do you identify these problems? Yeah, that's what you're asking. Yeah. So things to look out for. Like I mentioned, the easiest thing is realizing over time, are you putting on more weight? And the main location, it's not other parts of your body. The thing that you have to look out for is your abdomen. So that's your waist size. So taking a measuring tape over your belly button and measuring kind of the largest diameter. So that's the easiest thing that everyone can do themselves, right? That's one thing. Blood pressure. You don't need to go to the doctors anymore to have your blood pressure checked. If you go to any pharmacy and you ask the pharmacist, they can check your blood pressure. If they are worried about the blood pressure, they will tell you, okay, at this point, you need to go and get it checked into your doctors. Again, you don't need an appointment to get a blood pressure check at the GP either. So, for example, almost all practices, if you just go into the reception area, they'll have a machine there that you can go and just measure your blood pressure. And again, if it comes back as high, it gets recorded on your medical record and you'll get a call back from the nurse or the doctor as well. And also these days with Amazon, it's very easy to buy a blood pressure machine. They cost about £10 and you can have one at home. It's always nice to have, like in case of an emergency, you're worried. Like these days, people call 111 when they're unwell, right? And it's okay. It's often very handy to have that blood pressure machine, to have it measured. If you're feeling unwell, you can tell it to the 111, to the doctors, and that makes it easier for them to assess you as well. Those are the 2 things. So that's kind of, relatively easy to find out. High blood sugar, obviously, you mentioned, it's not really detectable without a blood test. So whenever we do blood tests at GPs, routine blood tests, we always use the opportunity to test people for diabetes. Anyone who's had that blood test will know it's the HbA1c. And quite often, especially in younger people, what I see, even today, I saw like a 33-year-old man with it. They have the blood sugar for the diabetes test in the pre-diabetes range, where they don't necessarily have diabetes, but it's in the pre-diabetes range. And we tell people, look after your diet and things like that. But there is a problem underlying that, which we'll talk in a bit more detail. But that is that your body's actually struggling to deal with the sugar, the carbohydrates, the sugar. We'll go into that in a little more detail, that you're eating. And that's causing a lot of damage. So the ways to maybe think about in terms of how are you feeling, whether you have those problems. So symptoms of problems with having high blood sugar: feeling really tired, feeling very thirsty, that even after you drink a lot of water, you just don't feel like, that's enough. Suddenly going to the toilet to pass urine more frequently. And even unexpectedly, suddenly you may start to lose a bit of weight. So those are the signs of diabetes. So even when it comes to pre-diabetes, things that you can look out for is like a lot of people may experience it. It's like even after eating a nice meal, maybe it has an ice cream or lots of fries, things like that. A few hours afterwards, they just feel really hungry again, like really, tired and down all of a sudden, like they need to eat more, even though they've had a really big meal. So those are signs that your body's actually struggling to manage your blood sugar.
Thank you so much. You did said routine blood test. I'm going to deviate a little bit. When is it medically advised, as a GP? When are we supposed to be going for routine? Because I can tell you that I have some people in the last 5 years, 10 years, they've never gone for any blood test routine. When is it advisable for people to test themselves?
So if you realize that you're starting to become just more unwell, things are not quite, you think there's something going wrong, you're feeling very tired, that it can't be explained with what's going on generally in your day-to-day life, and you're worried about something, almost all GP practices these days, they have an online request system where you can just put in a form, type in your symptoms, and you just state it in the request form. I'm worried that something's going on. I would like to have a blood test. And most GPs, they will be okay with organizing some routine blood tests. The other opportunities is when you hit the ages of 40, 50, 60, so on, you can ask the practice that if they offer kind of like NHS health check. And with that, you can see a nurse who, again, will check your blood pressure, weight, height, those sort of things, but also organize blood tests.
Good. Thank you. So I think that's actually well explained. So obviously we now know the signs and symptoms to watch out for. And then, but what are the causes of this metabolic syndrome? What causes all these things?
So to put it very simply, and it's not the only cause, but I would say like the biggest contributor to the problem is the food that we eat. And this is the food that we started eating as children and the food that many of us are giving to our children. So to kind of obviously, like I've talked about terms, metabolic syndrome, all the signs and everything, I want to kind of describe to people the root cause of where it's all coming from. And to do that, I kind of want to take you through a journey of what happens to your body when you eat, for example, a Big Mac meal with a Coca-Cola and a McFlurry ice cream. Okay? Not everyone has that every day, but you can imagine that's a very common thing that we have in the UK. And in many parts of the world as well. You can substitute that with any kind of processed food that people have, taken apart and refined it, add sugar to it, and packaged it nicely and advertised it to you in any way. So let's talk about, so you eat the food, it goes into your stomach, your body starts to break it down. And generally with all types of food, it breaks it down into three main things, which are the carbohydrates, which are things like your, rice, pasta, potato chips, ice creams, all those come under carbohydrates. Fats, which we know about, like oils, like the fat from meats, things like that. Protein, which again comes from meats, certain vegetable beans, things like that. To keep things kind of simple, I'm just going to talk about how your body deals with the carbohydrates. So that's your, rice, like ice creams, fries, those sort of things. So your body starts to break the food down the moment you start chewing it. And your body's very clever. It already starts to sense how much sugar is in the food that's just gone into the mouth. And your body starts preparing to digest it and to process it. So it goes into your stomach, mixes it all up, and it goes into your intestines, and then the digestive fluids in your intestines start breaking it down into even further. And what they try to do is break down these carbohydrates, like your pastas, rice, things like that, into glucose. Glucose is the main fuel for our body that most of us use, that our brain loves to use, is the main fuel. All the cells in our body like to use it, make energy to keep our body running. So it's very important that your body controls the level of glucose in your blood. So I'm going to use the word glucose and sugar like interchangeably, just to kind of, explain the whole scenario. So let's say once the sugar is in your blood, you have a very important gland in your abdominal area called the pancreas. And that secretes one of the most important hormones in the body called insulin. Have you heard of insulin before?
Sure.
So most people tend to hear it when they hear like someone has diabetes and they've ended up on insulin. Yeah. But it's actually a very important hormone in your body that controls your sugar levels. And the way to think about insulin is that it's like a gatekeeper. So our cells, all the tissues in our body, they have a very tight membrane. They really like to control what gets in and out. And insulin holds the key to open the cells to let glucose in, so that your cells can use it to make energy. So going back to that Big Mac meal, lots of fries, lots of ice cream and things like that. So all the sugar from that Big Mac meal is in your blood. And the insulin tells all the cells, open up, let me in. And then the cells use that sugar to make energy.
Okay.
But then you've just had a huge meal and there's a lot of sugar in that meal. added sugars and all the natural sugars as well. And that's actually a lot of sugar that your body doesn't need in that moment. So then the extra sugar is just floating around in your blood. And your body doesn't like that. Like I mentioned, it has to be very, certain levels that your body likes to keep it at. And that's when your liver steps in. So liver is a very important organ in your metabolism. A lot of people know it as like it's a thing that detoxifies it, keeps your body like healthy and so on. When there's a lot of sugar floating around in your blood, your liver says, okay, all right, come in. I'm going to turn you into another chemical we call glycogen. To put it simply, it starts turning the sugar into fat in your body. It initially puts all the stores in the liver, but again, all that food that was in the Big Mac meal, it will fill up the liver, and soon the liver is going to run out of space. The liver then takes the sugar that it's changed into fat, that turns it into kind of a cholesterol that goes into your blood, and then your fat tissues take it up. And again, insulin is the gatekeeper there. It tells the fat tissues open up, and it stores all that extra food that you've just eaten into your fat. So that's the normal physiology. So your body has a way to deal with sugar, and if there's extra sugar, it knows exactly where to put it. But imagine over the years, starting as from when we're kids, I remember my parents getting me full sugar Coca-Cola almost every single day growing up, and treats and things like that. Imagine putting your body through that every single day, and your body's working hard to deal with all the sugar, particularly your pancreas gland. So every time you eat something that has this sugar, it secretes a lot of insulin hormone. And the insulin keeps going on, telling all your cells, open up, let the sugar in, let the sugar in. And you can imagine if someone is banging on your door all the time, eventually you just I'm just going to ignore this person. I'm not going to listen to you. And then you start developing what we call insulin resistance. And this is key. This is one of the key things that lead to metabolic syndrome. Have you ever heard of that term, insulin resistance, before?
Not really.
Yeah, so it's not something that's very talked about. Even let's say when I, was in medical school, it's something that's briefly mentioned, but not widely talked about. And often we're taught in medical school, 5 years out from when you finish medical school, half of the things that you need to there's new information that you need to learn about.
True.
So things have been changing, and this is coming more into the forefront, and not a lot of people realize this problem, insulin resistance, causing a lot of different problems in your body.
Oh, thank you so much. I really appreciate and really love the way you're actually explaining in the medical terms and relating it to a layman language for all the audience who are actually not in the medical practice, and it makes it so that we can understand. So the next question I would like to ask you, Dr. Sebastian, is what are the statistics of people dying? Because people are just hearing we're talking about metabolic syndrome, and then people are like, okay, so are we going to stop? We've treated diet, obesity, we've treated quite a lot of diabetes on this show. So what are the statistics of people dying from this metabolic syndrome?
Okay, so that's a good question. And like I mentioned, this is a kind of a condition that you recognize with all these little problems. You don't directly die from metabolic syndrome, but what happens is, like I mentioned, going back to the start, all these problems going on in your factory, and you run into trouble, and then problems develop. That's exactly what's happening here. So with metabolic syndrome, your chances of getting high blood pressure, it goes up.
Yeah.
Okay, you're 2-3 times more likely to develop high blood pressure. You're again 2-3 times more likely to develop type 2 diabetes. You're more likely to get heart attacks, strokes, and another condition. Some people may have heard it, it gets picked up on whenever some people go for a scan. Is fatty liver disease. Okay, so I'm going to go through these complications and why this is so important.
Please go.
So we know that high blood pressure you get it, it increases the risk of strokes, also increases the risk of kidney
Kidney
damage.
damage.
Yeah, to put it simply, it can also damage your eyesight, your heart. Causes lots of problems. Type 2 diabetes also causes us a lot of similar problems. To just go from the top to bottom, it can like affect how you work day to day, like your, how your brain functions and things like that. Over time, you can lose your eyesight, and you have increases your risk of heart attacks. You need more medications, insulins, things like that, kidney damage, things like that, increases your risk of heart attack. So I know that's a lot of, scary things that suddenly
I know.
happen. And it's like, okay, this is too much. But it's kind of important that it's like, how is this all, why is it important? Why do I need to listen to the scary thing, this metabolic syndrome?
Exactly.
And like the personal reason why I want people to know about it is this is starting very early in children. Just, I think it was yesterday, I saw a 4-year-old boy who was already had fatty liver,
Wow. 4-year-old.
4 years old. It's a typical thing that I see, like, certain kids, not all of them, they, you know straight away that they're bigger for their age. Like, 4-year-old that looks like a, 6, 7-year-old because of how big they are. And parents always tell me, oh, they're very fussy eaters. They only like to eat crisps and sweets and things like that. We need to get them to eat something, so this is the only thing that they will eat. Some people, as you imagine, are more like let's say genetically more likely to develop certain health problems, right? But if you are putting a child's body through all this processed food, certain children are starting to develop these problems even earlier.
Wow.
In the UK itself, childhood obesity is a huge problem that's getting higher and higher every year.
True.
I mean, the NHS is having to create new clinics to
To
cope
deal
with
with
this.
it.
So and I know people, like, when it comes to, like, doing things for themselves, it's like it's hard to do things for yourself. But if anything people want to take away from this talk is really think about what the food is doing to our kids. So like I mentioned, it's not just something that happens one off. It's the meals over many years and how your body's coping with it. Over many years, it develops this insulin resistance, and then gradually, by the time that you're 40s, 50s, then all these problems start to creep up. And worldwide, especially in the UK, we're actually starting to see our life expectancy go
Dropped.
down.
Yeah. Yeah.
Yeah. And there's a reason for that. And I always think, like, why is it that, like, a lot of elders, they get into their 80s, 90s, they're okay, they have a few health problems, but they're kind of generally well. And then you can look back into history and think, yeah, they grew up in a time where there wasn't a lot of processed food, there wasn't a lot of added sugar in foods. And then slowly in, like, the 50s, 60s, 70s, especially in the last kind of, 10, 20 years, things have got up. So in the UK, for example, money doesn't lie. Like 50, almost 50% of the food that we eat in the UK in a year is ultra processed food, which is food that is taken apart from how nature was meant to be created. Put it processed in a factory, chemicals are put in, add sugar is added in to make it taste better, and they multiply the food so that it's cheaper, and then they sell it to us. And this is, over time, is the problem. You mentioned about, like, how people say, okay, I have to diet and exercise and all those things, but I'm not saying you have to not eat this, not eat that. The only thing that perhaps, like, to think about is, like, am I eating real food? So you were asking about the statistics. Sorry, I kind of got a bit sidetracked there. So just to put it, like, so mentioned about, for example, diabetes, heart attacks, and things like that. So in the UK, in a year, 14,000 people die every year from diabetes-related complications. Well, 160,000 people die from heart attacks. a bit less than that get strokes, and they don't necessarily die from the strokes, but they develop serious complications like paralysis and so on. And apart from death, what perhaps what we can never control when we die, right? It's not really our decision, but what we maybe have some influence is how healthy are we until the day we die, and that's what you should really think about. It's like recognizing whether you have these problems, and the good news is there are things that you can do in your day-to-day life, not necessarily just taking medications, that you can do to reverse this or prevent this.
Thank you so much. I think the touching parts is actually that I need to actually kind of stress enough is the part that younger children are having these symptoms or this syndrome, and come to think of a 4-year-old having a fatty liver, that is just extreme, and
Yeah.
which could have been avoided. And this is actually not a genetic something that you would say probably is unavoidable. This is something what you feed the system, the body. So, and
Yeah.
I hope our parents are listening, because we are so busy with our day-to-day lives. All we do is just go to Asda, Morrison, buy all this process. I'm not saying don't do that. I'm saying it should not be 70% of what the kids are eating. Is not ideal, is not really good for. And to be honest, to be fair, and I know this kid, they like sweet things, and that is where we parents needs to be firm, to then put our feet down to say, you know what, cook food for them, cook homemade food for them, not just any food, not fast food. Pushing more protein into their system, not too much of sweets. And I know all these kids, they like all this fast food, McDonald's, or everything you can talk of. Treats once in a while, but it's alarming that little kids, because
Yeah.
at the end of the day, is it reversible, the fatty liver?
Yes.
Good.
That's the amazing thing about your liver, is that you've maybe even heard of stories like whenever someone needs a liver transplant, they have a relative who's generous enough to donate part of their liver. So your liver has this amazing capability of, if you take half a liver of someone and you put it in a new person, then that liver will grow into full size normal healthy liver. So it has that capability to reverse the damage that it can have. And the key thing is then, like, making those changes in the food that you eat, so that your liver is able to take a break from constantly working hard to change the extra sugar that's in your blood into fat. And when it gets that break, then yeah, the body's able to just use the fat that is stored, and then get rid of it, and then it will heal. And I can't stress enough, even like a few years ago, I would send a lot of patients for whenever they come with tummy pain, for an ultrasound scan of their tummy, and they often don't find anything serious, but always the report says they have a bit of fatty liver. And I always kind of tell them, oh, yeah, it's a fatty liver, change your diet, get better, we can run some tests to make sure it's not severe. But it is actually a huge problem. We often hear of alcoholics really damaging their liver and needing a liver transplant. But it's predicted, for example, in the USA, that in the next 10 years, rather than alcohol, its fatty liver is going to be the biggest reason for needing a liver transplant. And that's just in the next 10 years. So it's a problem that people always say, if whenever you go for a scan or things, they may say, yeah, your doctor says you've got a bit of fatty liver. But that's something that you can reverse yourself with the food that you eat.
Thank you. So, I think my last question is, you're already into talking about it. How can we treat all this
Yeah,
metabolic syndrome? How can we treat
yeah.
them?
So starting with someone like who say that they have all the problems, like they've been to a doctor, And doctors necessarily may not use these terms like metabolic syndrome. They'll often say, okay, yeah, you've got high blood pressure, you're getting pre-diabetic, yeah, you've got with too much weight going on, you need to lose weight. But often they don't tie things together to say like, you've got this whole problem going on where your body's really struggling. So if you have those problems like high blood pressure, diabetes, yes, important to take the medications that your doctor prescribes, and then keeping it taking on the responsibility of like if you have high blood pressure, if you have diabetes, you need yearly checkups. If the practice doesn't contact you, you contact them saying like, yeah, it's my turn to have a checkup. Can I book an appointment, things like that. um so that's one thing, like taking the medications if you have those problems like high blood pressure, high cholesterol, diabetes. But before that, and like I mentioned, even thinking about our kids, and like even if you feel healthy right now, but you realize, okay, yeah, even just simply like, yeah, I have a bit of extra fat in my tummy, and I should have mentioned this before. It's not simply the fat that's like under your skin that's causing the problem. Is that when people have a lot of fat, especially around the abdomen, especially certain men as well, they look skinny, but they just have a lot of fat, just big belly. The dangerous fat there is actually the fat that's lying on top of your organs, such as your liver and your intestines. It's a different type of fat compared to the fat that's just under our skin. And that's the ones that cause problems. I should have mentioned that a bit earlier. So just going back, yeah, how can you treat it? So, like I mentioned, there's lots of fat diets, like saying low carb, low fat, this and that, so on. I think the main thing should be focusing on just eating real food if you can. Like food is nature mended. So this is like, your fruits, your vegetables, beans, nuts, fresh meat, fish, whole grains, things like that, that is not, processed in a factory. Because the stuff that they put in, and I'm not talking about the preservatives and the additives and things like that as well, but for example, ice cream has fructose, high fructose corn syrup. That's something that they add. It's just a form of sugar. Your body absorbs it like sugar, but it doesn't process it very well. This actually causes an element of inflammation in your body. Your body's actually working harder to process that and turn it into energy than if it was something like, you were getting some sugar from rice, for example. And some people may relate to this, that you have like a nice ice cream or something, but then like an hour or two later, you suddenly feel very tired. That's because your actually body's actually worked really hard to process it. So real food, I think, should be the main thing that people should focus on.
Good.
And then, like realizing if you feel that you are actually eating too much and you've been putting on too much weight, then figuring out your portion size. Because again, it's easy to talk about, oh, you should not eat this food, that food, and things like that. But in a real, like, day to day, when we're struggling, when we're working full time, we're like, the cost of living, all the food and things like that, it's as simple as like maybe real food and just reducing your portion size, because those are just two things that you can simply do without too much hassle in your day to day life. Then exercise. Everyone knows that they need to do exercise,
Of
and
course.
that it's but it's hard to fit into our daily routine, right? So starting off with little things, you know, getting off the bus stop a bit earlier so that you're walking that extra bit during your day, taking the stairs at work. Now, when it comes to metabolic syndrome, particularly, there's a particular type of exercise that's better for it and to
Okay.
reduce your risk of all these complications that I mentioned, particularly diabetes. And that is resistance training. So that's your weights.
Okay.
I'm not telling everyone to get, I know it's not realistic to go and just lift weights and things like that, but, maybe carrying your shopping, um, carrying something heavy just for a bit longer than you usually would. Keeping in mind that you keep your, back straight, your knees bend when you're lifting those sort of things, keep your back healthy. And especially for women, I believe, and not a lot of people talk about this, keeping your muscles strong as you get older is very important. Now, so why are your muscles important when it comes to metabolic syndrome? Is because your muscles can absorb a lot of the extra glucose and everything that goes into your body. It's like a sink, and it just absorbs it. It takes away the stress of all the extra glucose that can go run around in the rest of your body causing problems. So if you have more muscle, the insulin resistance comes down and your body's better able to cope with it. And the reason why I mentioned it's more important for women is especially as they get older and like after menopause and things like that, your hormones go down, your bones, they get weaker. So having stronger muscles makes sure that your bones are stronger and reduces your risk of fractures and things like that in the future as well. So when it comes to exercise, it's not just like, going on the treadmill or running, things like that. It's often easier to just do some resistance exercise. And I wouldn't say easier, you can just go on YouTube and put in body weight exercises. 10 minutes, 20 minutes. You can even do it with a bag of rice at home rather than like, investing in a lot of like, equipment if you don't have that.
Of course.
And these days there's so much resources. If you just go on YouTube, the free, like there'll be someone, a personal trainer working out with you for, 10 minutes or 20, 15, 20 minutes. And you can find that time in your day-to-day to be able to do that. And that will help in long term. So just to tie it all together, how can you treat it? So recognizing the problem. If you have those problems, like, and your doctor says you need medication, taking the medication, attending like, regular checkups to make sure that things are not getting worse. But even before all of that, focusing on food, real food. And if you can get a bit of exercise into you, building your muscles a bit stronger, that will really help.
Thank you so much. And I think if we look at the issue of exercise, this is what I recommend to my patients in terms of the exercise to strengthen, especially women, to strengthen your muscles. You know the milk we buy, the milk we buy in Asda's. We have 2 liter, yeah? There's 1 liter. Just fill it with water. Yeah, maybe the 2 liter or 2.4, or get 2 of it, so you don't need to buy anything. You can look for this and when you finish using your milk, you can just fill it with water, get 2 of it to train yourself. Even if you think you're tired, you can go on the YouTube. It's so easy because I understand some people, they finish from work, they're tired, but you can sit in the comfort zone in your house and still do this exercise, because trust me, it's better to avoid having these things than to start treating them. Dr. Morris, correct me if I'm wrong. I have a patient that they have diabetes, high blood pressure, and obviously there's this other underlying physical problem. I can't remember on top of my head. And I was in a medical review, and they were saying, and the patient was complaining about one of the drug. They're kind of she's reacting kind of to the side effects, and later the consultants were like, these 2 medication cannot work. When you have diabetes, you cannot use this. I can't remember the name of the medication on top of my head to say she can't. The patient cannot be using this medication with this one. So they don't work along the same way, because sometimes there's drug interaction, and it kind of doesn't go align with one another, and you have to start thinking or being placed on another medication, because for diabetic, the basic diabetic medication that we know about is the number one they start people on type 2 is what? Metformin. But for somebody who has high blood pressure, or for kidney patients who has a kidney issue, you can't use metformin.
So only if you get to, so metformin is generally a very safe drug. It's very commonly used, and it's like the first line. There's a reason for that. So when I talked about how this insulin resistance, so metformin is great for kind of reducing that insulin resistance. So when people start it, that gets better, so that improves their blood glucose levels. It also, improving the insulin resistance also makes you lose a little bit of weight when you start the metformin. So the main reasons when you need to consider stopping metformin is actually quite far down the line. One, if you have bad side effects, the most common ones being really upset tummy, where they get a lot of diarrhea and bloating and pain when they're on metformin. So then you can switch the type of metformin. So that's one thing. But then, if you had diabetes for many years and you also develop kidney problems, and you're actually kind of like towards the end stage of kidney problems, then metformin can, if it accumulates in your body and you become unwell in a certain situation, you can get what we call lactic acidosis. So at that point, it's advised not to be on metformin. So
Exactly.
it's, I would say, like, 80-90% of cases, it's safe. And then if you develop other complications, then it's advised not to be. So usually, like in GP practices now, because everything's kind of electronic, whenever we prescribe medications, we have a kind of an electronic assistant that flags up, okay, be worried about this interaction, things like that. So in primary care, over the past few years, that's improved. But I know from working in hospitals and things, sometimes that's actually not that easily available, especially when it comes to like, prescribing psychiatric meds and like then mixing with, the general physical health meds and stuff like that. So yeah, I've been there and it can be difficult.
Thank
But
you.
if you're worried about any interactions, you can always go to your GP. You don't necessarily need to speak to the doctor because a lot of GP practices hire clinical pharmacists who deal specialized in the medications themselves, and they can explain things to you and look for all these problems as well.
Thank you for that explanation. And I think my point is, why put yourself in that situation when you can avoid it?
Yeah.
When you can treat it and avoid it with the right diet and exercise in the first place. So I'm going to open the line now. Before we open the line, I will want everyone on, if you're online, we're going to actually get me the timer, 1 minute silence to this noble artist that passed away in Nigeria. The reason why we're observing this 1 minute silence is, amongst all evidence that came online, I saw a particular video that this individual famous, which I don't have any contact or any personal relationship with, but I am actually a fan of the music. And I saw on the video that this individual had high blood pressure at the age of 27. And it wasn't like high blood pressure as a result of whatever. According to the evidence that surfaced online, we saw a lot of brutality, molestation, bullies, beating. This individual was really dealt with. So as an individual, as a professional, I felt really pained. And like I said, we're going to observe 1 minute silence. So Mohbad, Ilerioluwa Oladimeji, Aloba, and also for one of these my darling sister that passed away just yesterday, and for every other people going through one problem or the other, which has affected their mental state or affecting their mental state. So let us observe 1 minute silence in remembrance of Mohbad. May his gentle soul rest in peace. So now the line is open for everyone who wants to call in and ask any one question or to the GP, Dr. Maurice Sebastian, 079 35 31 8757. I repeat, can one of the admin put the number online, please? 079 353 18757. If you want to ask any question, please call in now and ask the GP. You don't have to introduce yourself. Just ask your question. That is actually the reason why we are bringing out this program, for you to have the opportunity to tap from their experience, so that you can ask any question, you can verify. And I think there is, before, while we're waiting for the call, somebody put on the Facebook to say, will NHS health check include a blood test? Dr. Maurice?
Yes, it will. NHS health check will include a basic set of blood tests to screen for things like your cholesterol levels, diabetes, your kidney function, liver function, full blood count.
Good. So I think, so for the individual person that asked the question, so another admin, please tell her to read the chat. Okay. So can you please call in, because we are on live. Sometimes it's hard to be diving on Facebook to be reading the chat. So call in to ask your question. It will be good if you, the number is actually online. If you have any question. So my little girl, somebody said my little girl and I was listening to this program, and she said, "Morning, please give me a heart sign, because this is what my teacher taught us today in class." Okay, so I don't know what that means. Please give me a heart sign, because this is what my teacher taught us today. So if you have any question, this is the time to call in and ask. So somebody said, "Thank you, Dr. Bo. If is an inheritance, what?" I think that somebody is asking, is it genetic?
Okay, so when it comes to genetics, there's no kind of single thing that you can say this is a gene is a problem that will cause this condition. But what we have to think about is, like, what are the genetics to a certain extent? Yes. So looking at your close family, if you know that your mother, father, their parents, or your brothers and sisters have these problems, then yeah, you can safely say that it runs in your family. Okay, so those are the things that I'm talking about when it comes to blood pressure, diabetes, high cholesterol. So yes, there is certainly that genetic problem there. Going a bit deeper into that, it's like, why are we in the kind of Western world suddenly getting more of these problems? And I put, like, I'm from India, so like the South Asian like population, and people from the African continent. You may look back. I'm going to use the example. So like I visited Tanzania a few years ago, and then subsequently I read some research that they had done on the people, the Maasai tribe. So these are people that still kind of live I'm going to simplified hunter-gatherer life, right? So they
Let's pick the call. We'll come back.
Sure.
Hello, you're welcome onto today's program, Your Health Matters.
Hello, good evening.
Good evening.
My name is Gary Joseph. I have a question.
Okay.
Yeah, my question is, I noticed that most people that has high blood pressure, they end up having diabetes as well. Why is it like that, doctor?
So what I mentioned today, this concept of insulin resistance, it could be one of the underlying problems that connect with these two problems. So it's going to go into a little bit of detail, perhaps. So high blood pressure, can be many causes. The way insulin resistance contributes to high blood pressure is that insulin, as the hormone, when it's released, it has an effect on your blood vessels. And high blood pressure comes from a problem with the blood vessels. So as your heart is pumping blood around your body, your blood vessels need to be flexible. It needs to kind of adapt to it and relax when it needs to and stiffen up when it needs to. When it comes to high blood pressure, the blood vessels coming out of your heart and all over your body, they have more tension. They're not able to relax. And that's why we call high blood pressure. That's why we check when we do the blood pressure check, we're essentially checking the pressure of the main artery that runs through your arm. Okay. Insulin has an effect on your blood vessels when it's in the right kind of levels. that it can relax your blood vessels to a certain degree. But over time, when you develop insulin resistance, your body's mechanism of having the blood vessels relaxed, that switches off and it goes into another mode where your blood vessels become more stiffened. So that and the effects of insulin on your kidney can contribute to developing high blood pressure. But then diabetes is because this insulin resistance is going on. And like I mentioned, your pancreas is working really hard to put insulin into your body. And over time, your pancreas starts dying from working really hard. And the cells that produce insulin, it can't do it anymore. And that's when you start causing type 2 diabetes and further down the line where people end up needing insulin. So the connection is there. And then going deeper down, like, what is contributing to, like, high blood pressure, diabetes. And I'm again going back to like the food that we eat and we started eating from when we were young, because that's how, like, society and like the food industry and everything kind of gave us, has been slowly causing these problems. And that's one of the biggest problems that's causing it. Yes, there are elements of, like, genetics contributing to it, but genetics makes our body vulnerable to these problems, and the food and our environment manifests these problems.
Good. Thank you so much.
I hope that answers your question, Darren.
Sure.
Does that make sense?
Yeah. So I can see people are trying to call in. Yeah. Okay. Hello, you're welcome to 47th edition of Your Health Matters program.
Good evening. Thank you. Good evening, Dr. Sebastian. Thank you so much for the knowledge you've imparted us today. My question is, how often can you request for like an MOT test? Because how often can someone request for MOT test? Is it yearly or every 6 months from one's GP?
I didn't catch that. What test was that?
How often, I think, is a routine test. You called it MOT test.
Yeah. Okay, the MOT test. Okay, so from the NHS health check point of view, you can ask it from the age of 40 to 74. Okay.
How often? How often?
How often? Okay, yeah. So
every 6 months.
Blood tests. No, so once a year is enough. Okay, more than enough. If like, say, I'm just using it as an example, you turn 40, you have a blood test, everything's okay, and you're feeling healthy, you don't necessarily need to do it every year. But then if you have problems like, high blood pressure or diabetes, pre-diabetes, then I would recommend having it checked on once a year.
All right. Thank you so much. Thank you very much.
Thank you so much. So the line is open. You can call in because I've missed a few calls earlier on. You can call in.
I hope that the person's still listening. It also depends, for example, if you have diabetes and, it's not well controlled, then we may say, okay, you need more. So sometimes we bring people in every 3 months, 6 months, depending on the situation.
Their needs.
But once a year, or if you have these problems.
Okay, thank you so much for that. I was going to add that tip to say, actually, if the test says everything is okay, then follow that. Or if they actually, or even after it's okay and you're feeling funny or you're unsure, I would recommend go. There's no harm in checking again every yearly or 6 monthly to be safe, to say everything is okay. So the number once again is 079 353 18757. If you want to ask any question, we've got a few more minutes before we wrap up for today. So while we are waiting for people to call, I want to say in summary, what I actually learned from this topic is let's learn to live and eat a better diet, exercise, and I think with these two things, if you don't already have it, I remember somebody asked me that question to say, what about the people that already develop these symptoms? How can they manage it? So what would be your advice?
Okay, so I mentioned, if you have high blood pressure, if you have type 2 diabetes, things like that, let's diagnose, and you need the medication, your doctor says you do, yes. you need to take the medication, but still doesn't change anything about what you have to do with your food. Because it's like running a car. And if you go to, like, it used to happen, I remember in India, if you go to a really dodgy petrol station and, get the really cheap petrol, they often put little things in it and the car starts backfiring, right? Other than medication, the thing that we put into our body every single day, several times a day, is the food that we eat. So even if you have these problems, if you are able to change the food that you eat and eat healthier and eat food that doesn't cause the processed food, for example, causes inflammation in your body. If you take that away, the inflammation goes down, and then your blood pressure can improve, your diabetes can improve, like your cholesterol levels can go down, and you feel more energy and you feel better. And it's all about just asking yourself the question. It's like, not like how long do I want to live or things like that. It's how long and how healthy do I want to be when I get older. Well, the term calls health span. And just ask yourself that question before you, eat a particular food that you may not know it's healthy. It's like, this is really what I want for myself. Of course, I'm not saying like, if you want a treat and you need to treat, have it. But then when it comes to like every day, are you making the right choices for yourself? And like, coming back to the question, yes, you can improve things by eating healthier and, like you mentioned, exercise as well. But
Thank
really
you.
the food that we put in.
So I'm going to pick up the last question. Somebody's asking on the Facebook, is it possible for someone that has high blood pressure to stop the medication? I think that is actually is no, until the doctor actually recommend, or they say it's safe to do so, because that's actually go on, doctor.
Yeah, it really depends. I would not advise stopping it without actually speaking to your doctor. The reason being, if you have high blood pressure over a long period of time, your body itself, it changes. The way it works changes. And like I mentioned, your blood vessels get stiffer. And sometimes it gets stiffer because calcium goes into your blood vessels and they become harder as well. And that's something that happens with age as well, something that we can't even control. So if we stop the medication, that problem is still going to be there in your body, and then increasing your risk of problems to stroke and heart attack and things like that. So that's a conversation that you have to, if you really wanted to come off medication, if you're not tolerating the side effects, speak to your doctor, because there are many different blood pressure medications. And if your blood pressure is actually well controlled, discussing, because ultimately what you put in your body is your choice.
Hello, sorry, Dr. Sebastian. Yeah. I've got somebody on the phone, and I don't know why they're not able to get through to the studio line. So, but I've got somebody on the phone. Go on with your question. I've put you in speaker up. The doctor can hear. Go on.
Okay, thank you, Dr. Sebastian. Thank you so much for the explanation with regard to the topic today. You've made it really very simple to understand. I needed to ask you one question though. What about intermittent fasting? Is it okay with regard to diabetic type 2?
So yes, so intermittent fasting is a concept that over the last few years has become very popular, and it's not something that I would necessarily recommend to every single person, but yes, it can work. The warning is, so if you are diabetic, you're on certain medications that increase your risk of your blood sugar going very low, then perhaps intermittent fasting is not suitable for you. But if you are not, you can ask your doctor about that, or look up the medications that you're on, the risk of hypoglycemia, the risk of low blood sugar.
Exactly.
But if you don't have those intermittent fasting, if you are able to stick to that routine, if you're not developing problems with your stomach, because suddenly if you're eating 3 times a day and then you're switching to 1 time a day, your body's still used to having a clock inside which tells you release acid into your stomach at 12 o'clock because you're about to have lunch. Because everyone feels that, right? When they get hungry, you get acid in your stomach. So it has to be done kind of a bit slowly, and make sure you're not developing any problems from the intermittent fasting. If not, then yes, going back to insulin resistance is really good to, research is suggesting more and more that it's really good to improve insulin resistance and in certain cases like type 2 diabetes. Yeah.
Thank you so much. So I think that is actually well explained, because if you actually have on medication and you do the intermittent fasting and you start having low sugar issue again, you don't want to start treating that. So thank you so much. That's actually going to be a wrapping up for today. I want to appreciate our guest on today's program, Dr. Sebastian Morris. I really appreciate your support for coming on today's show and imparting the knowledge and sharing your experience, teaching and educating people on how to live a better life and ensure that we don't actually fall victim, and the signs and symptoms to watch out for and how to treat it. I want to say a big thank you to all the audience as well, and everyone who has actually clicked like, share, and I want to appreciate all my fans out there, and I want to say a big thank you to everyone who has been there, and the admin and all the callers as well. Also to Dignity Media, thank you so much for your support all the time. And before we go, please make sure whatever you're going through, because this topic is a bit sensitive, and I'm glad we have a bit turn out people listening to it. Whatever you're going through, you don't have to discuss with anybody. Just ensure you go to your GP. If you're able to dictate it on time, the earlier the better. And I know we're all busy, but create time to be going for checkup. We don't really do it. Then the third thing I picked up from this show is, let us change the food we give our children. Let us help them, please. Let us reduce the processed food we give our children and ourselves, and actually push in a lot of protein, and increase our exercise, walk, and whatever you think you can do. Whatever you think you're going through, please seek support on time and speak out, speak to the right people so that you can get the right support. Remember, your health matters. So till I see you next month, I want to say, stay safe. Look after yourself. Bye.